Yat and welcome to 4 Directions of Wellness. I'm Roberta Diswood. Tuapaha Nishle, Sisakani Bashichin, Nakaidene Dashiche Hanani Dashinelle. Your personal health record is one of the most important records you have. It contains most of your medical information over the course of your health care. Many of us may have a need to access our health record. The Indian Health Service is making it easier for you, the patient, to access your health record, which will allow you to manage your health better. To explain the new personal health record system is Gary Russell King, Director of Medical Records and Navajo Area Health Information Management Consultant. Thanks for being here, Gary. Go ahead and tell us about yourself.
Hi, I'm Gary Russell King. I am born for the Red Running into the Water People Clan and the Zuni People Clan.
Well, thank you again. So what is the personal health record and what will it allow me to do as a patient?
The personal health record is actually part of the original initiative of the electronic health record mandate that President Obama put in place back in 2006. The Indian Health Service has moved forward with the Health Information Exchange, which now allows our patients to access any of their IHS medical records nationwide through this new personal health record system. So our patients will now be able to view those health records online on their computer or a mobile device, and they'll also be able to print it up.
Okay. And so what exactly will we be able to see?
Some of the key components that patients will be able to see right now are their laboratory results, radiology results, immunizations, last visit information, and any admission history. All those components will display and be able to print up on their personal health record.
So will this allow me to be able to go in and see when my next appointment will be?
Yes, the system will capture appointment information, so the patient will be able to go in to see when their next and future appointments are going to be.
Okay, that's really good information. And how will this allow me to contact my doctor?
Yes, the personal health record system has an electronic encrypted email system that will allow our patients to click the button and send a secure message to their healthcare provider. So for example, if they had a medical question about the care that they may have forgotten to ask the doctor when they were in the examining room, they can go into that system and email that doctor a message. Or maybe they want a refill, or they want to know when their next appointment is. So the system does allow that communication back and forth between the healthcare provider and the patient.
Okay. So who will have access to my personal health record?
It will be strictly the patient. However, the system will allow the patient to designate an alternate individual if they wish to choose to do so. When they do that, the patient can select whether they have total access to their record or limited access. So it's really up to the patient, but it can be set up that way.
Okay. So Gary, you mentioned limited access. What do you mean by that?
The patient can go into their personal health record and set the parameters where it could restrict that person from seeing maybe their visit information, or maybe restrict them from seeing their medication listing, or restrict them from seeing anything else that has to do with their admission. So that's what the patient can do, is pick and choose what they want that individual to access.
Okay. And from that, how do we know that our personal health record is secure and protected?
The personal health record system is actually a separate medical record system under the System of Records for the Privacy Act. So this record system abstracts data from the electronic medical record system, and it's kept on a separate server which is maintained in our Rockville, Maryland office. So it's actually a separate record system that has all the security measures in place in order to make sure that it's safeguarded.
How do I obtain access to my personal health record?
Okay, the steps are very simple. The patient will have to go to the web portal, establish an account name, a password. Once they successfully do that, there's 3 security questions that are asked. You know, with any online applications, they always ask you to set your security codes in case you forget your password. Once that individual enrolls online, one requirement is that they use their legal name, okay, because that's how the Health Information Exchange goes and finds all the health information at all the IHS sites. So they must use their legal name when they register. Once they successfully do that, they can go to patient registration at any one of our sites, IHS-wide, and patient registration will link their account to their personal health record. Okay, so once that's done, then the individual will have immediate access to their personal health record.
Okay, and is there any special equipment they may need for it?
They should have Mozilla Firefox or Chrome software installed on their personal computer in order to access this personal health record system.
Okay, and where can I go to enroll?
You could go to any Indian Health Service site. Most of our sites do have dedicated offices for their personal health record enrollment. They could also stop by patient registration and pick up a brochure or pamphlet. And lastly, they could also go to the IHS website and learn more about the personal health record there.
Okay. And Gary, is there anything else you want to add before we leave the show?
Yes, we would like to encourage all our Indian Health Service patients to enroll into the personal health record to have better access and manage their health care.
Well, Gary, I want to thank you for being here today. This has been 4 Directions of Wellness, Hagornet.